Hello, I am Mark Orlando. I am a physical medicine and rehab physician who specializes in interventional spine procedures. I am a physician with Group Health Associates in Cincinnati, Ohio. We have put together this video to help you make decisions as to whether or not these procedures are right for you, and if you've already made the decision to have a procedure done, to kind of show you what to expect during the day of your procedure.
The receptionist will check you in and direct you to the outpatient treatment waiting area. You'll then be taken to the pre-op area to wait for your scheduled procedure. From there, you will be taken to the OR suite for your procedure.
Today we're going to be doing a lumbar epidural steroid injection on your back to help out with your back and your left leg pain, numbness, and tingling. Most folks, when they leave here today, feel a little bit better. Probably 60 to 70% of people feel relief, if you will, of their pain from the numbing medicine that I put into your shot. That will wear off, and then the steroids will kick in a couple days later. The maximum effect is usually somewhere between 5 to 7 days from today. And I'm just going to place a little sterile sheet on your back, little metal probe on your back, nothing that's sharp. You're going to feel a little pinprick on the count of 3, just some numbing medicine. 1, 2, 3. It's going to burn a little bit down deep. Burn as I come out of your skin. You're doing terrific. Worst part of the procedure is over right there. Good job. You're going to feel a little pressure as the needle goes down through the different muscle layers in your back. We're watching everything we do on the x-ray tube or the fluoroscopy tube. I'm going to drop the steroid and the numbing medicine that we're going to put in here. All right, we're going to advance that needle down a little bit closer. You might feel a little bit of pressure. We're sliding into the canal right now. I'm going to squirt in a little bit of fluid, which we call contrast. That helps us prove that the needle is right where we want it to be at and not anywhere we don't want it to be at. You might feel some pressure as this goes in or nothing at all. I'm going to be putting in the first dose of your steroid medication. This is the L5 level, which is right where your disc is herniated at. If you feel too much pressure in your back or butt, let me know. 2/3 of the medicine's in there. You still doing okay?
I'm doing okay.
You did terrific. The first dose is in. I'm going to be removing the needle, and we'll go down 1 level and do the second injection and be all done. Little pinprick here. 1, 2, 3. Coming out of your skin is going to burn just a little bit. Worst part is over right there. Good job. The next thing you'll see on the TV monitor will be the actual needle tip itself. The machine's going to move now to a side view so we can take a peek and make sure we have the right depth. Everything looks great. I'm just popping through the muscle and a couple ligaments back here. Start to see the needle appear on the TV monitor close to your spine. Next, we're going to squirt in a little bit more of that contrast that we talked about. The contrast is flowing beautifully into the spinal canal where that nerve is being pinched. Next, I'm going to put in the medicine. Again, as the medicine goes in, you might feel a bit of pressure or discomfort. If it gets to be too much pressure, you just let me know and I'll slow down. All right, the last little smidge is about to go through. You're doing terrific. Good job. All the medicine is in and the needle is out. You did terrific. A little pressure. You're doing a great job as we're guiding that needle to where it needs to be. The last dose of medicine is going in and then we'll be all done. You did great.
Once Dr. Orlando has completed your procedure, you'll be taken to the recovery area where you'll be monitored for approximately 15 minutes, given discharge instructions, and be allowed to leave with your responsible caregiver.